session is going to talk about a brand new program that the state and the University of Wisconsin-Green Bay is partnering on called WIS Caregivers, Certified Direct Care Professional, and WIS Caregiver Connections. My name is Kevin Coughlin, and I'm a Policy Leadership Advisor with the Department of Health Services. And my partner here is...
My name is Casey Kapelzinski, and I'm the Lead Program Specialist for the University of Wisconsin-Green Bay. I'll hand this over to Elise, she's back here.
My name is Elise Gash, and I am the Administrative Assistant for the CDC Program Review Division. Thanks for being here today.
Yeah, so we're extremely happy to be here to talk about this new program called the Certified Direct Care Professional. And this is, we were fortunate enough a few years ago during the pandemic that our state agency had additional funding that was available through the American Rescue Plan Act. And then also we have funding that was called Money Miles per Person.
Thank you so much.
To keep people in the community. So we're kind of leveraging both of these programs to really attack the workforce crisis that I think a lot of people are dealing with and struggling with. So, so with that, we want to talk to you a little bit about the background of this program, kind of how it started, and then the implementation of it, and then to give you some new news about kind of how the program's running. And then Casey and Elise are going to give a little demo on how to sign up for this program for those caregivers and providers that might be hiring caregivers, including high-risk participants. So here's just a little information about myself and Casey. So that is in your, there is information on, you go to the conference website, and there's both this PowerPoint and some additional documents, both in English and Spanish with our fact sheet that should be available. So I think we're all aware of the extreme crisis that a lot of people are under. You know, there's so many vacancies, people are struggling to find caregivers. And so that's what we were, back in 2021, we participated in a number of, in a collaborative nationwide to figure out how best to sort of attack this problem. And we came up with sort of a multifaceted approach to trying to deal with the caregiver crisis. And then we also did our own research, and Casey's going to talk a little bit about that with our outreach to various stakeholders. So what we want to do is, number one, improve competencies with our caregivers. It's one of the big goals of this. There's really no standardized training that's available for our direct care professionals. And the word professional, we really want to raise the view of our caregivers. They are professionals. The work that our caregivers do is really the backbone of our whole system. And if it wasn't for our caregivers, you know, we wouldn't have the programs that we have available. So we want to raise up that recognition and awareness and get them credentials that can help with their skills building. And then we need to get more people in the system. And this is, we're going to talk a little bit about our marketing campaign to really bring more people into this caregiving field. And then look at sustainability. We have this funding during sort of a short time period until 2025. But if we build a good system, then hopefully we can sustain this into the future so that it's not just a band-aid during this time, but can be long-lasting. So I'm going to hand it over to Casey, who's going to talk a little bit about the program itself.
So as we've mentioned, Department of Health Services reached out to UW Green Bay, and we created this partnership. And people always ask, like, how did you gather the information to even know what people wanted, right? Because that's a really important piece. You have to ask the people what they want. So we had listening sessions with 26 stakeholder representatives and 60 workers that all participated in giving us feedback on what is missing, what would you like to see more of, what is working well, you know? And then we also did a survey that went out to direct care workers, providers, and stakeholders. We had over 500 responses, which, you know, surveys, it can be tough for people to respond to sometimes. So we were pretty proud of that response rate because it really helped us gather that information. And our program consists of several components. UW Green Bay developed the curriculum and the 14 competency areas. So there's 14 areas. We'll talk about those a little later. Give you a little more information about that. We have a proctored competency exam. So it looks very similar to a CNA program. CNAs go through their training and then they take an exam that they have to pass with a 70% or greater. And we really want to mirror that because this is a professional program, this is a professional job as well. And so it looks very similar. We have a public registry. If anybody is familiar with like the certified, the CBRF registry that UW Green Bay holds, it's exactly like that. And the CNA program has a registry, so you can search and see, is this person taken this course and are they certified in these skills? And then we have a tracking system that actually Elise is really our reporting guru. She really maintains all of our records to show how's the training going, how's the testing going, who's been employed, and how is the retention rate. We aren't quite to retention rate yet because we aren't at 6 months, but that is definitely something we're going to be tracking. All right, so competencies. So we identified 14 major competencies that we thought would be beneficial for these certified direct care professionals to learn about. And there are, common things like assisting with activities of daily living, like dressing and meal prep and cleaning. But there were some things that we found through our research that were really glaringly lacking. And I'm sure that none of these will be a surprise to anyone in this room, but some of those things that we really focused a lot of time and effort on was training these care professionals in person-directed practice, not necessarily person-centered practice, which is a very common theme that we hear as well, but letting the person you're caring for direct what their care looks like. And how is the caregiver coming in, especially if you're brand new to the field, how do you learn those skills? What does that look like? Where's your role in person-directed practice? One that is very important to me, I was a disability benefit specialist and a long-term care ombudsman for most of my career. So we have a large training on empowerment, advocacy, and self-determination because it is so easy for caregivers, especially because we're short-staffed, to get caught up in the duties and forget about the people. And remember that these are human beings that have the right to tell you what they want. And we have an obligation to provide that. So that is the part that I'm really proud of and that I feel really passionately about our direct care professionals learning because those are things you don't know coming off the street into this career. Community inclusion, networking, and relationships. Obviously, especially in the pandemic, people with disabilities, our elderly population, were isolated more than anyone else. We pushed them in, stay home, this is dangerous. And we know how important socialization is to our health. It is one of the single most important things that we make sure we maintain to live a long life. So we talked about how the direct care professional can be a part of that. Because sometimes if you're doing the direct care, it can feel a little bit like you don't have a role in all of those things. Because maybe there's a care manager or there's somebody else that's helping with that stuff. But really, we all have a role in making sure that all of that works out. And then another piece that was really important to us was cultural competency, respect, justice, fairness, and equity. We want to really have culturally competent caregivers. As we move forward, as our populations diversify, they need to understand what culturally competent care looks like.
So now we want to show a little video of sort of this program that we're introducing today, and so you get to find a better feel of why we did it and how we're doing it.
With Caregiver Careers, a free certification program to increase the number of caregivers in our state.
Direct care workforce professionals are so important in our state because they are the backbone of what is supporting our home and community-based system.
So if you need support with regular activities of daily living, if you need support with cooking, if you need support with bathing, these are things that we can bring to you in your home with the support of direct care professionals.
80% of the individuals now live in the community versus in an institutional setting. We are one of the few states in the nation that has accomplished that goal. That is a much more cost-effective option for people. It's what people want in the future. The demand for this workforce has ballooned in the past few years and it continues to surge in the decade ahead. We estimate that between 2020 and 2030, long-term care
combination of those factors is cutting edge, and it's among the top in the country. WIS Caregiver Careers is a professional workforce advancement program of the Wisconsin Department of Health Services in partnership with the University of Wisconsin Green Bay. Visit our website at wiscaregivers.com.
Just pause to make sure everybody is set up as they need to be. You guys all good? Is everybody ready to go? You give me a thumbs up. Okay, excellent. Want to make sure everybody can hear everything. So just to kind of move forward on what does this training entail? So it is online, which I know can be a barrier for some people, but we found that what we heard during our research is people weren't able to travel to go do it. They don't have the time, they don't have the money, they don't have the bandwidth to go travel and do it. So we wanted to make it as accessible as possible for as many people as possible. So it is online. It is self-paced, which means that you can take it as slow or as fast as you would like to. And most importantly, I think, yes. At the end of the year, we will have the curriculum in Spanish. So it is not there yet, but it will be at the end of the year. So it's in process already, it's being translated currently. And then the entire course, including every button, every tab, every bit of language in that course will be in Spanish. So nothing in it will be in English. We will also do the exam in Spanish as well. Yep, that's a great question. I was gonna get to that, but you beat me to it. So it's free. That's obviously a huge draw. It's where I should probably always start. It consists of several modules that go through those 14 competencies. So it's broken up in small chunks because we recognize that those that are already working as caregivers don't have a ton of time to take out of a day to get this done if their employer isn't able to get them the time to do it on work hours. So we wanted them to be able to kind of come and go as they please in short chunks. It's approximately 30 hours of training, which is a lot of training. It can take, it can take a while if you have a lot of things that interrupt your day, but we're finding that people are getting it done, I would say, within a month. Once they start it, they're done within 30 days and ready to take their exam. And again, we have those 14 competencies that I kind of went through on the previous slide.
So part of the program is, like we said, we want to train 10,000 people for this program. And once the individual has completed their training, they took their test, and now they're on the registry. If they're currently working at a provider that is part of the home and community-based programs in the community, whether it's working for an IRIS participant or working in a family care program, they would receive a $250 check, and that would come in the mail approximately a month after they start their employment or stay on their job. You could be in your current job and take this training as well. And then 6 months later, you would get another $250 check in the mail if you stayed at that same employer. So we're really encouraging people to stay on your job, retain those skills, and we will reward you with a bonus. So some of the things that we're doing, we really want to attract new people as well. So we want to bring up competencies of current caregivers, but we really need more caregivers, with all the vacancies that are out there. So we have a very comprehensive marketing plan that you may have seen some of these commercials on TV. We're on the radio, we're in some of the newsprint, especially like up north where people get that weekly newspaper. And then we're also doing a lot of social media. So you might have seen some of these advertisements of trying to recruit these individuals. And then we also have a very unique partnership with the Green Bay Packers. So we are at every one of the home games. We're up on the Jumbotron. So you can kind of see this, that big thing up in the upper right. So a little advertisement for us. We're also in the corridors where we have video monitors around where people are walking for the concessions and things like that. So we have some advertising there. We were at the here's Casey at one of the training camps, so we had a display there. And we were also at the Packer kickoff, the music concert that they had a few weeks ago. so we were at that. And then also we're on their greenbaypackers.com. So, I think if you can align with the Packers, it's kind of a cool event. And what they're trying to do is really raise up the awareness that, caregivers are such an important job and important for all Wisconsinites. But it also, contributes to the work that we're doing. So I just want to show you an example of one of our ads that you might see either on social media or in the news.
People across Wisconsin are enjoying the rewards, stability, and flexibility of a career in healthcare. Why not you? Wish Caregiver Careers can get you started as a certified direct care professional. You'll learn the skills you need to make life better for older adults or people with a disability. All training is free and online, plus earn $500 in bonuses. Start your new career. Sign up today at wishcaregiverscdcp.com.
So that's just one of our real short video clips. So, back to
So we've talked, yeah, absolutely. Can I bring you the microphone so everybody can hear you?
I could talk louder. They can't hear you.
Yeah, we'll use the microphone if you're okay with that. Come to you.
Have you guys thought about using like freshmen college students? Because 25 years ago, and we were in college together, we were approached before starting school about I worked for an agency where we got to come to the dorms a week before school started, and they gave us direct training for 40 hours. And we did an extensive program, and were trained, did the testing, things like that. And I think there was like 40 of us in one freshman class that was providing personal care. Not just the students, but people off campus, and we got to carry that with us. And so, and all of us that did that are almost all still providing care or have agencies that did.
That's amazing. Yeah, that is so cool.
Yeah, we're doing a lot with the high schools right now. If people are familiar with HOSA and youth apprenticeship programs, but college, that's a good thought as well. Was that in one of the UW?
It was UW Whitewater.
Okay. Yeah. Yeah, we'll touch base with you and see if we can't get contact there.
And I wonder too about online, just because of the passion piece that comes along with it, and like vetting for that, because you have to have a passion for it in order to be able to do that, understanding and meeting people where they're at, and that self-directed care. So I don't know.
Yeah, well, we're gonna touch on that a little bit with our micro-credentialing, so
Okay.
we'll talk a little bit about that.
I was just gonna say, okay, no, it's okay.
Can I just say something? The people online can't hear,
Yeah,
so
they're all
we can try to use the microphone, because
Yeah.
that's how they hear through.
Just in addition to that, my sister used to live at St. Coletta's, and I know a lot of caregivers that they had there were college students, like you're saying, from Whitewater.
Yep.
And it was the same thing. They looked at it as such a great way to have experience to be able to put on their resumes. So definitely, I think that is definitely worth something that you should look into more.
And that is why we're really truly trying to catch them in high school too, right? Because if they're gonna end up going to college for whatever their next step in their healthcare career is, if they start working in high school, they can keep those jobs, whether it's in the summer when they come home, or it's while they're at school, or it's all year round. And like you said, that is excellent. We know that the best caregivers have done every step of the job, right? Like the best nurses were CNAs for a long time, or direct care professionals. It makes you a better caregiver overall, whatever stage of the healthcare program or the healthcare career you're in. So we are really trying to tap into those different places, but I mean, I work at a university, and I didn't think to ask, our incoming freshmen is a great idea. to get them connected right away, because we do have a nursing program that perhaps it would be something they wanted to get started right away. So we are doing a lot of high school stuff because we see the value in that, in making sure that we're catching these kids when they're just starting to decide what they want to do and that next step, so that they have a way to start building their resume early. Those are all great suggestions. I appreciate them. This has been, I'll tell you, we have gotten so much from this conference. So we talked a lot about the training portion, which is the online caregiver portion. But another side of things is that we have a one-stop workforce portal. It's called WIS Caregiver Connections. It's powered by Handshake. So Handshake, if you're familiar, some of you may be, it is the job platform that the universities use in Wisconsin. It's really, really user-friendly, and it was something we had access to at UW Green Bay, so it was a natural fit to use that. So this is, if you are someone who employs caregivers as an IRIS participant, a family care member, someone who owns a home health care agency, if you employ direct care professionals in the community, you can access this job platform for free, and you can search for people that have completed the program in there. And the same thing goes for our certified direct care professionals. If they are not yet employed, when they come out of the program, they have access to this job platform to find employers that they know qualify for them to get the bonus. So it's a place that we can, and what's nice about, and I'm going to show you a little bit of the website later, but what's really nice about it is that all of the communication can happen within Handshake if they wanted to. You can message people.
I don't know what that interferes.
Someone off mute maybe. We good? Okay. I didn't know if somebody had a question or, okay. So all the messaging can be done. So if you are someone that is employing caregivers, you don't have to go outside of that system to communicate with them. You can see their resume, their qualifications, make sure they've gone through the program, talk to them, set up an interview, whatever you want to do, all right in there. So that was another key piece of it, is we need to not only sustain, because most of our certified direct care professionals that have finished thus far, we launched July 15th, already are employed. So we need to draw in the other pieces, we got to draw the new ones in, right? And they're going to need to find jobs. So Kevin will talk a little bit more about the numbers that we have. But I think one thing we're looking for, much like your suggestions, is what resources you think might be needed for people to better access this program. So that is something, if you want to start thinking about that, that would be helpful for us too. We're open to all suggestions. Hi. No, you're good. Okay, oh, this is still me. All right, so Wisconsin is supporting over 100,000 individuals in the community. And we know these settings continue to expand, and all of them need caregivers. So people will ask, where does a CDCP work? It's a very common question we get. So there's non-medical home care. We talked about being a caregiver for an IRIS participant or someone who's on family care doing self-directed services. They may work in adult family homes, community-based residential facilities, which are CBRFs, residential care apartment complexes, which are also known as RCACs. So that there's things like supportive home care, home health care, respite care, really anywhere they're providing the care in the community setting is what we're looking for. Because when we think about a CNA, they're generally doing their care in a nursing home or a hospital. So these professionals are doing their care in the community. It's still me. Okay. It's me all the time, you guys. I'm going to plug your mouse. Yeah.
Yeah.
Is there any questions?
Yeah, any questions while we're kind of taking a little spot here? Yes, Patrick? Okay, what is a care setting? So a care setting is a place where an individual that got this training would work. So it might be in your home getting care, it might be in maybe a supportive apartment that, maybe two people roommates are living together, but they need a caregiver to come in. Or it could be, like more of a facility base, like a 1 and 2 bed adult family home, things like that.
Such a question I have. How this is connected? How this is connected? How this connect? How this is connected to
So the community connections, well, actually, I'm not sure. Community connections, is that a program?
No. I'm just curious.
Okay, so we have something called Twist Caregiver Connections. So that program is trying to connect our caregivers that take the training to an employer. So that's how that's connected. Are you doing that? Yeah. Okay.
Full disclosure, you are the first people I've done a live demonstration for, so I'm very excited. Yeah, so please be kind. Can I answer a question?
Excuse me.
You're welcome.
One of the things that concerns me is how do we get these people consistent caregivers because a lot of them have trouble finding staffing their things they have. So how do we get these people good consistent caregivers so that they don't have new people coming through their door every day?
Yeah, that's a wonderful question and a very real concern, Ramsey. You know, we know that when people are coming in to do care in the home, especially, those are some really intimate moments, and having a new person cycle through every day is. Yes.
Can you repeat the question?
Oh, yeah. So the question was, how do we create consistency where the caregivers continue to show up day after day, instead of having a new caregiver every day, every week, every month? I think that I'm not surprised Ramsey asked me a difficult question, because it is a very multifaceted answer. But I do think one of the pieces that we found, and in all aspects of my career as a social worker, what I have heard from caregivers is they don't feel like they have enough training. And I think if you educate someone on how their job is supposed to go, because we know a lot of, especially in the pandemic, post-pandemic, facilities, agencies, nobody had the money or the time or the staff, the staff amount to take people off the floor and teach them these things that were really important. So, I mean, Kevin and I feel very passionately about educating people on how to be competent at their career. And I think also that's empowering. Once you start getting the knowledge, you start taking more pride in your career. You start wanting to show up for it because you feel like nobody likes to feel like they don't know what they're doing. And we're asking people to step into these very complex roles without training. And it's just not things you learn off the street. So I think education, which is the side that we're addressing, and the connection to employers is a really great start. There are obviously other pieces to that it's very multifaceted, but that's one of the big pieces we found in talking directly to the caregivers.
Yeah, if I could just add, go
I
ahead.
was gonna say, Larry online has a question, so
Okay.
I'm gonna tell him to unmute and
Sure.
ask his question.
And then we'll get the question. I'll come to you next.
Let's see.
Hey Larry, go ahead.
All right, well, let's maybe go
So
on.
here, and then wait for, okay.
Okay.
If he gets that figured out, or if he wants to
Okay.
type it out, he can do
Yeah.
that too.
So as a caregiver, another part of the problem is that there's no consistency in the hours that are given to these individuals that need care. I was caring for one individual and had to help him battle to get all of his hours back. So as a caregiver, you have to pick and choose kind of who you want to work for that you know is going to make it through that yearly screen if you're doing it on an individual individual basis, because if I'm gonna do that for my income, I also need to be somewhat confident that year after year, they're gonna have the money coming in from these agencies to be able to pay my wages, or am I gonna be out of a job and then have to go look for the next individual to take care of?
Yeah, it's a great point. And one, I think one of the scope of work, so we're, this program is going to continue. We're doing a number of other things. We first wanted to get this launched, get it out the door, get people to start taking the training. But one of the things that we're hoping to have at this, for this with Caregiver Connections is support for both caregivers and for employers. And one of the things that we're talking about is webinars, where we will help providers really to create that culture of a place where people want to come to work and they want to stay. And things like what you're saying, you know, consistency, where you're getting the hours, you're not getting overworked. So we're trying to, those would be things where we would help create, you know, standards of practice for good.
Can you unmute Larry?
You know,
He said he
creating a
can't
place where
unmute.
people want to come to work and they want to stay.
Which one's Larry?
Sure.
Helen? No, you're.
Oh,
Larry.
this is great.
Not
The
yet.
more interactive, the
I still
better.
don't see a Larry.
Have you guys thought about, or is there any talk about
Yeah.
creating a
Just
system
wait, though,
where
'cause it'll
caregivers can
cause
look
a-
and see
it'll
if
cause
there's
a
other people that need support in the
Mhm.
same area? Because, like, if you're a provider who's providing come-in support, and somebody only needs support for 20 minutes, is there a system being created where they can look, like, area-wise, and be like, okay, I can, like, back, see, people who need different things at different times?
Yes.
Because as a provider, that would be something I would be looking for, and something that I had scheduled for
I'm not sure
when
if
I
he's
was
gonna come
doing
out
direct
with
care,
the
so.
sound.
He
it's
will.
very helpful.
He will?
Absolutely.
I mean, it worked yesterday. Okay, I think
we get it
they have to unmute Larry, so we're gonna unmute Larry. Tell him.
We're gonna get to that.
Is he unmuted?
I clicked the button, now he has to accept. There we go.
Okay, let's see now, Larry. Ask Larry to talk.
Larry?
Okay, go ahead, Larry. You want to give us your question?
Yeah, I'm a provider for a friend, and I'm wondering if things for me, I've been in the field, I've employed through an agency firm for about 7 years, but I also had to use a wheelchair myself, but I'm a peer because of the living report. It's just something for me that I want to pursue, certified care professional. I suppose it could help my understanding.
Yeah, Larry, I think you'd be perfect candidate to take this training. So you can take it online. It will be free. You're already working for, it sounds like, for an individual. So you would be eligible for the training and also the bonus once you completed the training. And if you're currently working for someone, then you would get that bonus after completion, and then 6 months later, if you stay with that employer.
Okay, yeah, because it's not like I can roll into anybody's home that has steps in it, for example.
Right.
So I started wondering, should I even take this class?
I think the beauty, Larry, would be when you then became eligible to sign up for Risk Caregiver Connections with Handshake, you could sort of identify your accessibility needs for the work that you would need to do. And that could be communicated to somebody that was looking for you as a caregiver.
Personally, if I can't get
Post
it,
that I can unmute Larry too if I need to later. I'm sorry.
so that's
I had that issue
wondering is to see
Oh, you couldn't do it. Okay.
how do I create this account?
Yeah, so we're going to do we're going to do a demonstration on how this all works. So thank you, and then so your question, yeah.
Yeah, I will address that in our next slide, so that will be addressed for you. So, and if you feel comfortable both on Zoom and in the room, by a show of hands, how many of you are currently caregivers? Okay. Okay. And then, how many of you know about this and signed up for it already? Yes. All right, yes, cool, excellent, that's wonderful. That is more than I expected, so that is so great. So I am, okay, you ready? I'm gonna do this. I'm going to give us a demonstration on both the caregiver side and the employer side. Because I think that we obviously have a mixed group, so I think it's important to see both. I'm not gonna go quite as deep into the student or caregiver side, because I really wanna focus on the question that was asked is, how do I find people that need care? So we'll talk through where you can find, let me exit out of that. And that, let's see. Okay. Oh, I gotta share my screen here. Give me 1 sec. All right, can you let me know, everybody, on, you guys can see it on Zoom, are we
I
good?
can see it. Yeah.
You're good? Excellent, okay. So this is our, oh, I don't like this though. There we go, okay. This is our WIS Caregiver CDCP website. So this is our main website. UWGB also hosts the side of it, so I will show you that side as well. But this is kind of where most people are going to kind of be driven to when they hear about our program. So if you stop at our table and you get a card with a QR code on it and you scan it, you'll get here. Most of our promotional items will get you to this website. So I want to kind of just touch on a couple things on here for the caregiver side of things. So what's really nice is we've made it very simple to sign up. So you can click right here, and what you will get is the screen that talks about the bonus and how to apply. So on the UW Green Bay side, we manage pretty much everything. So we do all of the fulfillment of this program. So when a caregiver goes to sign up, they will go through and sign up for the course using this form. It talks about different parts of demographics that they feel comfortable answering. And that's just for us to kind of gather data to know who's coming through our program. And then after they complete this form, we send them the information to take the course online. So we do some vetting, because right now it's only available to those who are serving people in Wisconsin. You can live in a border state, Minnesota, Illinois, and still work in Wisconsin. We allow those people, as long as the person you're serving is a Wisconsin resident, you can take the course. And another thing I want to highlight is we're talking a lot about the bonus, but what we found is that we were getting emails and calls from people who were not yet on any sort of services because they don't qualify, they aren't ready to go on them, whatever the reason is. Maybe they, whatever it is. And they have informal caregivers with their family and friends that are taking care of them who are like, I really want these skills. I know I can't get the bonus, but I really would like to take the training so I know what I'm doing. So we opened it up for those caregivers who may not qualify for the bonus because they're not working for someone that is a qualified employer, but still want to get the skills. We've had a great feedback on that. So that's a newer piece of this that we opened up, and I just wanted to make sure that everybody knew about that. But the side of things, so I'm just going to give you a quick step-by-step. So it's this form, then they go in and take the course. Elise and I are the people that you would talk to. There's not it's just the two of us. So if you need help, it's one of us that you get to help you. After taking the course, we go in and we provide feedback on all of the answers just so that people know they're on the right track. And we're checking to make sure that they're absorbing the information. We want to make sure that there's, that it's clicking all the right buttons for people. Or if there are things we're lacking, we have students that'll say, I wish this had more of this. And that helps us create a better course. And then following the completion of the course, they actually will take an exam. We do that online as well. It's proctored via Zoom. There can be a few technical difficulties, but I would say 95% of people are really successful, and we are able to accommodate people that need it to be done differently. And that includes maybe they need more than the 2 hours of allotted time to take the exam. Maybe they were having technical difficulties, they need another attempt. So we're very accommodating on the technical side of things because it's really important that people have access to do this. Once they complete that, we ask them, do you have an employer? If so, we verify that they are employed and that their employer qualifies, and then DHS sends them their bonus in the mail. We are not yet to the 6-month retention. We launched July 15th. So we haven't made our 6 months yet, but at the 6-month mark, what Elise and I will do is reach back out to everyone that has already received their first bonus and verify they have to still be with the same employer. Because again, we don't want to encourage job hopping, right? That's not going to be, that doesn't solve our problems at all. So we'll reach back out and we will give them their second bonus if they are still employed. So I'm going to leave that one, and I want to talk through the employer side of things. So how many people are employing caregivers, either as IRIS participants, family care, SDS participants, family members of people on programs? Okay. Yep, Ramsey, I know. Ramsey's been such an integral part of this. He was helping us very early on. It was wonderful. So to answer your question, if I am someone who's doing care and I want to find people that need care in the same area, how do I do that? That's our job matching platform. So you can search in your city for all the job postings. And if you want to work specifically for IRIS participants are employers in our system. We want them to have access to find certified care professionals that have completed the program. So as an employer, the way that we would go through is there's this little spot up here for agencies and providers. It's going to look pretty similar at the front end for the application. So I'm going to fill that out quickly. I'm going to pause. Kevin, do you want to maybe take questions or see if anybody has anything they want to offer? You want to talk about something? Give me 1 second. Oops, sorry, you want to take that?
Ramsey, you got another question? Yep. Okay.
What if somebody is not on IRIS or family care, but they're on, say, Medicaid or Medicare?
Yeah, so we are allowing individuals, so Ramsey's question was if you're not on family care or IRIS, can that person still get the training, right? Ramsey, are you talking about the caregiver side or the employer side?
Yeah, they should be able, both.
Okay, so for the caregiver, we are allowing that person to get free training. They wouldn't get the bonus because they're not working as a paid caregiver for a program, but they would get the free training. And on the employer side of it, we are requiring the person to be part of our home and community-based program, to be an employer, to be able to hire people. Because the one thing that we don't want is, so UW Green Bay is labeling these providers, so that handshake isn't open to the public, for example. Because we don't want like hospitals and other agencies to come and get all of our good caregivers. Now we've created this great program for our community, and then people come in and grab other people. So we are keeping those employers, we're vetting them when they apply. UW Green Bay, make sure that they're part of somebody, their IRIS program, or they're part of family care in one of the networks for the managed care organizations.
Okay, I'm going to take that back unless there's other questions. Yes? I'll be right back, Patrick. I'm going to grab this one, then we'll grab yours.
I don't have a question, it was just a comment of, too bad you couldn't engage like Boy Scouts or Girl Scouts with a merit badge or something, but, obviously they're thinking about service and so on, so maybe that's another group to tap into.
Yeah, I think, if they were willing to volunteer in a setting like this, and those skills would help them, yeah, I think they could certainly qualify for that training. Great question.
I have a question.
Yes, ma'am.
I can't do long-term care reports 2 days.
I'm sorry, say that one more
I
time.
can't do long-term care reports.
Long-term waivers. How does long-term waivers fit into this?
Long-term care reports.
Long-term care waivers?
Yep, so they would So children's, yeah, that's a good point. Some of the children's waivers program, they would also qualify as an employer and for caregivers that work in those waivers.
Public care, it's my choice, public care.
Yeah.
Yeah.
Yep, and I'm gonna talk through that right now, actually. So you're beating me to the punch. You're ahead of the game. Okay, so I'm gonna go through this. I want you to just kind of see what it looks like. So as an IRIS participant, a family member of an IRIS participant, someone who needs your own caregivers, wherever you land, this is the employer application. So you can see at the very top, there's a spot, it identifies if you're an IRIS participant, put your name. If you're a CLTS participant, put your name. Or agencies and facilities. Provider license number. If you don't have one, which if you were an IRIS participant, you wouldn't have a provider license number, you can type 1. We have tons of different entity types, including IRIS and CLTS participant, because we want to make sure that it is encompassing anybody who can access this program. To Patrick's question, we ask what MCO or managed care organization they belong to. So that would be like My Choice Wisconsin, Lakeland. They can choose as many as they want because employers sometimes, facilities especially, might contract with several. I'm gonna set this up as an IRIS participant. So I don't have an MCO at this point because I'm not on family care. And I'm gonna choose my Medicaid program because again, we're focusing on those employers and individuals who access home and community-based services. So those are people that receive Medicaid benefits and get Medicaid reimbursement for their services. So I'm going to choose IRIS because I'm going to act like an IRIS participant for this. And one of the things, so we have all of the different entity or provider types. From an IRIS perspective, we included micro boards, which we were really glad to hear that they were interested in participating. IRIS participants, CLTS participants, and then really every other type of home and community-based setting. And I do not have a legal entity. So then there's the contact information. That can be your name, that can be someone that helps you with things. It can be whomever you want, and an alternate person that would be able to assist you. So that is the end of the application. That is all that needs to be filled out. So I'm going to submit that. I'm going to get a message. Right here. So the message says, thank you for registering. You're going to receive an email on how to access your WIS Caregiver Connections powered by Handshake. And then it also, just a disclosure, it sometimes goes to the junk folder. So if you're looking for it, check there, because it could be there. And I'm going to wait for that email because I want you to see what it looks like. But in the meantime, I want to show you what our website has on it, particularly in the FAQ, because I think that this is a place I direct people to often. So there's pretty standard questions like, how do I do this? Where do I work? But I think what's really nice is talking a little bit about when and how the bonuses will be paid, because I think that's a question we get a lot. Like, how do I get my bonus, right? So we actually just did our first round of bonuses. So it was our very first one sent out. And it actually gets sent directly to the caregiver. So the employer doesn't, if there is an employer involved, doesn't have anything to do with it. We don't want them to be the middleman in it because they're not responsible for paying it or having anything to do with it. So DHS sends that directly via a paper check in the mail to the address that the caregiver provides to us. It takes about 30 days after we send it to them on the 15th and the 30th of every month, and then approximately 30 days after that, people receive their bonus. But that is a really common question we get because that's an important part of it is, I want to get paid to do this, so tell me how that happens. And then there's my email. So I'm going to pull that up. So you'll get this email if you sign up as an employer, and it tells you thank you for registering. As a qualified employer, you're going to have access to our job platform. And then there's different instructions depending on where you fall. So if you're a brand new employer of like a facility or an agency, you'll follow the first instructions. I'm an IRIS participant in this scenario, so I'm going to follow these instructions. And so this entire instructions, you'll get this in your email. It's also available on our UW Green Bay website, which I will show you. But this has all of the information, and we'll go through it step by step, I think we have time, on how to do it. So we come through, we're gonna start at the beginning, and I'm gonna click on employer registrations and handshake. Oh, it's gonna do that, so I'm gonna do this. I need another window, I have 3 screens at home, so I am feeling,
It is very hard.
I am feeling very deprived right now.
It's working though, you're going from screen to screen.
Okay, and let me know if it's too fast or you have questions. So I'm gonna sign up as an employer because I don't exist yet. So I'm gonna use my email and I'm gonna create a password. Oh, that email is already existing. Can I reset my password? Okay, hold on a second. Anybody have any questions while I reset my password? Okay. Tell me when I take the...
I may have missed this, but how old, what's a minimum age that you have to be to participate in this program?
Yeah, so we don't really have a minimum age. There could be some restrictions on when you, with your employer, on how old you have to be. But we do want this to get into the high schools, so even like 16-year-olds. And it could be where they could be a direct care worker hands-on, but maybe they start with helping with activities or companionship kind of roles and responsibilities. So, yeah, so it's really more on the employer side for that. Yeah, that's.
And I created a Gmail address for this specifically, and then it told me that my phone number was used too many times to verify it, and I've only been in it once. So I'm not sure. But I will show you around, Handshake a little bit, because I think it is it's a nice system to take a look at. So I'm gonna take, this is if I were to be a caregiver. So if it's a caregiver accessing, I can go in and search for a certified direct care professional employer by choosing, again, Kevin kind of mentioned we have those filters, and you can choose to filter that. And it will show me the results. So these are, I can choose to apply right in here, which is pretty cool. There's one job found in my area that I chose, so I can apply for the job in here. I can attach my resume as a caregiver. I can pretty much do everything start to finish in here, which is really, really nice. And then, actually, Elise, do you have your sign-in info for Handshake at our career services, so you can switch to an employer? You want to come up here and sign into that? Yeah, why don't you do that? You want to do that? That'd be good. Yep. Lisa's going to take over. Sorry, guys. I was hoping that would work better. All right. Let me just log on here. Thank you for being so patient. Watch with my luck. It's going to lock me out, too. I know. So like Casey said, I am kind of the person in the back end that approves everybody and gives them this public label. When you get into Handshake, so if you're an IRIS participant and you get into Handshake and you're approved, what happens next is I label your account with a public label. You get a public label, and the people who are looking, are CDCPs that are looking for an employer, also get the public label. That's how we connect the two of you on the job matching platform. Just a second here. Does anybody have any questions in regards to that kind of job matching part that we have with At the Curiosity Corner? Yes, so we can sign you up live today at 2 p.m. if you want to either take the training or become an employer. Elise and I will both be there on either side of things with our computers. That's from 2 to 2:45. And additionally, if you're looking at this and feeling overwhelmed and you're like, I don't know what's going on, I feel a little bit that way and I'm doing it. So you can, like I said, it's me and Elise that you would talk to, right? So we can make time to have a phone call with you, shoot you some screenshots and an email, set up a Zoom or a Teams call with you. We have access to all of that to walk you through. Teams and Zoom might be nice because we can share our screen and you can share yours back. But we're more than willing to individualize that for you. So if you're feeling overwhelmed and like you wouldn't know how to work it out, we will help you with that. I don't want you to feel like you're not going to you're on your own once you sign up, because that's really not how it goes.
Larry has a question.
Oh, and actually, Patrick had a question. Emily says.
Okay. Do you want to unmute Larry?
Okay, Larry will go.
All right.
Go ahead, Larry.
See
You
if-
can ask your question.
He is not unmuted. Let's see.
Go ahead, unmute Larry.
I sent him the request. He hasn't accepted after.
Okay.
I'll parse it again.
It's saying he can't.
Okay. Well, while you figure that out,
Yeah.
Patrick asked
We're
his
good
question.
now?
He's good now.
There he is.
Sorry, technical difficulties.
That's okay.
So, I could use a little help sometimes in my situation. Can I have two profiles? One where I need help, where I'm weak, and two where I can offer help and get the course when I can be of assistance to peers?
Yes, and you will likely have to have 2 email addresses.
Which I do.
Excellent.
I'm just
Then
kind
yes.
of wondering,
Then yes, you can.
kind of weird. I know it's kind of like being a player coach.
It's actually not weird. It's very common. You would be surprised at how common people wear 2 hats. They both caregive and have caregivers, so it's not uncommon at all.
And I take pride in sharing what I can offer my friend Mark, and then not afraid to ask for help when I need it, or
Yep.
could use it when things are, for example, too high to reach in the supermarket.
Yep, absolutely. No, you would be that'd be great for you, Larry. You could absolutely do it. If you want to connect, our email address is in the presentation, and then Elise and I obviously are here today, but she will be back tomorrow, and she can get started on anything you need help with, okay?
Now, you mentioned 2 to 2:45.
Oh, that's just an in-person program that we're doing here at the conference. So,
Oh, so since I'm virtual, that doesn't apply to me.
right.
But we could set up a different call with you at your convenience, like another Zoom call, and we could help you that way.
Yeah, I'd be interested.
Okay, yeah, definitely. So Larry, if you want to maybe put your email in the chat or send an email to our email address, whichever you prefer. If you don't want your email to be public, I understand that. We will be able to connect with you too.
I mean, spam so much anyway.
Okay, and you can put it in the chat. We'll make sure to grab it out of there.
I just did.
Oh,
I'll put
yeah.
the other one in there as well.
Okay, that's
Can
perfect.
you do your question at the end?
Well, is that okay? Lisa, we'll grab the questions.
Oh, okay.
Okay, so this is just kind of what we see on our end, and I'm gonna just kind of take an employer here that we have, and what it kind of looks like on their end. When they apply, I can search, so it is my duty to go in and look at this. And look, and once you create it, so if you're creating an IRIS participant, the steps are in here. And then I search for your account, and then I give you this public label. So see, there's this public label here on this account. And this is really what is matching everybody together with CDCPs who are in the area, as well as employers. If you go through the IRIS participant guide, it gives a really good outline of exactly what's needed for additional details, and like how to fill everything out. It also provides a lot of screenshots and a lot of information. So I would suggest really, I know for my going through this, what I did is I read through the instructions first, and then I did it because there's a lot of multiple steps. So that you can do that in here, and then what it does here is it creates the handshake account. Now, if you are creating for an IRS participant, there is an extra step here, which is really important. And I know I'm going through a lot, but it's the final step, and this is actually, and Larry, if you want to look at this too, this is the email address that you can send your information, and we can schedule the meeting with you. But you email us once you create that, because we just want to get you certified and labeled right away and make sure that your account's approved.
Yes, as an IRS participant or a family care SDS participant, as an individual employing caregivers, Handshake was originally built for employers to find college students. So we're kind of using it like you would use a medication off-label. Like, we're using it because it has the capabilities to do it. It has the abilities for us to connect you with those labels and kind of hide you in the system. But their automatic verification system doesn't know what to do with individuals who want to find caregivers. So we have you make sure to email us so we can verify with Handshake directly their trust and safety team. This is legitimate, we want them to have access. So that step is, other than creating your actual account, the single most important one, because we've really been kind of tweaking this process for individuals finding caregivers, because it's been never used this way. It's really a really innovative way to use Handshake, which has been wonderful. And Handshake is really seeing the possibilities with it as well. But it has had a few bumps along the way. So this is actually the way we have found our final step, that we can make sure that everything goes smooth and nobody is rejected as they come through. I think we'll maybe touch base on the testimonies. I would like to read those, and then we'll take questions. Thanks for being patient. Sorry, that was overwhelming, I know, but we'll help you. You can call us, email us. We'll help you with it, I promise, step by step.
So, the other thing that we heard from especially our direct care workers when we were doing the town halls and getting their feedback, was that people were interested in a career path. So we're looking at kind of how do we create those career pathways and create, knock down as many barriers as possible for the caregivers, so that they don't have to, if they get a new job somewhere else, that they don't have to repeat everything. So we're working with our colleagues in the Division of Quality Assurance that licenses and regulates like 3 and 4 bed adult family homes, community-based residential facilities, and our residential care apartment complexes, and personal care agencies. And we now have some crosswalks so that an individual, if they're a certified direct care professional, they wouldn't have to take all of the training. They may still have to take a fair amount in some of the settings. So there's a link here that shows sort of all of those different regulations, training, and what they don't have to take and what is already met. And then we're also exploring the possibility of laddering from a certified direct care professional to a CNA. So some people might want sort of that, in high school they might see themselves as a registered nurse, for example. So now they'll be able to see sort of that ladder from certified direct care professional to CNA to RN as a progression in their, what they could even start as a freshman, for example, in high school. So we're working with those programs. And then as we talked about earlier, these are the different high school programs that we're involved with Wisconsin HOSA. Regional Career Pathways, we're on the map now. It was a pretty big win for us, so that teachers now know that they can send their, we're along with the certified nursing assistants, so these are opportunities for high school students and the youth apprenticeship program. So Casey's going to talk a little bit about kind of where we at right now.
All right, so these are our most recent numbers as of last week, I believe. So this is our student pipeline. So these are the caregivers that have come through.
You know what? That's not showing up now.
It's not.
All of a sudden, I'm just realizing.
Oh, it's not showing.
So these are going to be on the PowerPoint that is online.
Yeah, they can
so
see it.
I'll
It's
talk
just
through
not-
them too.
Yeah, they can see it. It's just not.
like that?
So these results are as of October 12th. We had 3,467 students or caregivers do the very first step of registration. So that application I showed you, we've had almost 3,500, I'm certain by now, we've had 3,500 people register for that first step. Of those, 2,074 have taken the second step to actually go into their course. So 3,500 approximately registered, 2,000 have moved into that second step, 1,100 have completed at least one of the modules. We have 86 people who have completed all of the modules and are waiting to schedule or have scheduled their exam. We do exams 4 times a week, every week at varying times, and if people can't fit those into their schedules, we stay late, come early, whatever needs to happen so that they can get their exam taken. We currently, as of 10/12, I know that's more because people have taken the exam yesterday and today. We have 78 certified direct care professionals. So those are 78 people that have actually completed the course start to finish and passed their exam. Of those, 55 were already employed. So like I said, the majority of people that have finished are already employed. So our next focus will really be pushing to those new caregivers. And we don't have any 6-month retentions because it's not been 6 months yet.
Hi, this is Amber Mullet from DHS. Do we know why we've lost so many in between the first steps, or why individuals are not completing from step to step? Is there any way to find out?
Well, it's continuous. So people are they're just getting into the first step. They haven't gone to the second step.
Okay, is that like
Yeah. No, we have not lost those.
No, they're not gone. No, they're not gone. They just haven't gone into the next step. And we do reach out to people we have, different benchmarks. Like it's been 30 days and you haven't set up your Canvas account. Can you tell us, do you need help with it? Some of them just got the email in the beginning and were already CNAs, for example. They're like, I don't know, I just signed up, but I actually don't need this. Okay, that's fine. We can remove you then. But we actually then deactivate them so they're not going to be in the count. So anybody who says they no longer want access to it is not in these counts. But that's a great question. All right, want to go to the next one? So our employer pipeline, we had 560, actually the employers are not as good at taking the second step as our students are. So we have 560 employers so far that have registered with us, and only 133 of them have taken that second step to do a handshake. We just like with students, we reach out to say, hey, what's up? Can we help you? What's going on? Are you still interested in this? So we are keeping a pulse on people that are not moving forward, but the employers take that first step, and I think some of that, when we're talking about agencies and facilities, is they have turnover too at the administrative level. So they're like, if Elise signed up as the administrator at the CBRF and now she doesn't work there anymore, and suddenly I'm there, I might not have known that this step was taken. So that's why we're kind of following up to say, what else can we do for you?
We apologize. It sounds like we're having a little bit of technical difficulty for the people online. Sorry about that.
Well, I'm going to read, and that's our last actual slide of numbers, which again, those are all available on the conference website. But I wanted to share just what we have a.
There you go.
Oh, you got it?
That's working.
Excellent. So we have an end of course survey where we ask for feedback. We want to know what's working, what's not working. Did you get anything out of it? Did you find it beneficial? And these are just we've had, I feel so privileged to do this work. We have had resoundingly positive feedback from our students. They are hungry for education. For many of them, this is their first experience with formal higher education. Because most of our students are high school graduates or have gotten a GED. Some of them don't have their high school diploma, so they've never touched a college course in a college learning management system like Canvas. And they're finding that they're very successful, and so it's been nice for them to get their feet wet. As we talked about, maybe they want to take the CNA course and kind of grow their career. They can do it. It's an example of they're capable of doing it. So Dawn had said, I found it all amazing. All the information was crucial and pertinent in helping me to be the best CDCP to those I take care of. This program was put together very nicely, so much information, it was great. Brandy said there was a lot of great information that helped remind me of old things I've been trained on, as well as new things that I was not really up to date on. I think the course in all was great. Corey said, all of the information was very helpful. I think that crisis prevention and intervention is what will help you the most. Larissa said, thank you for offering this program, and I would recommend everyone taking, regardless of their level of experience or training, because it is very informative. And Sylvester said the course was most impactful and several new things were taught, especially of how to show more concern to the individual we are caring for. I'm now more prepared to be a real caregiver with empathy. And these are all people. All of these are ones that I chose that were already working as caregivers. So they were people that have experience. This is not, completely new information to them, but they did get a lot out of it. And I just feel really grateful that we get to do this work. It's pretty wonderful. So now, I know you have a question, right, Patrick? Yep, and then we'll take questions, I think, right? I think we're open up for questions.
Just a reminder that we will be at Curiosity Corner. For those that saw the Native American dances earlier, that's kind of that section where we'll be. And we'll have so people want direct help, we can sign you right up.
So this is a control logic skill, how this will connect to members.
How does it connect to members on long-term care?
Yes.
Okay, that's a great question. So if I know you are with My Choice, right? You work with My Choice, Wisconsin, correct?
Yes.
Yes. So if you were someone who needed to find a caregiver, because you are directing your service, you're doing self-directed services, if you needed to find a caregiver, you could sign up, Patrick, as an employer, and you could search our job platform to find caregivers that completed our program. So we would help connect you with caregivers that are looking for jobs in your area. So that's how it serves you. Or if you're someone who receives, supportive home care or home health care at home, and you work with an agency through My Choice, the people that are employed at My Choice can take that are employed at the agency, can take the training, and they can then get the education to help better take care of you if they're coming into your home. And they can get that $250 bonus. So there's a couple different ways that it benefits the members of long-term care. You're welcome. Yes.
Larry had a question about whether, even in the handshake, do people go through a background check before they're able to even go into the handshake?
That's
Yeah. So we do not do caregiver background checks at this point. So that is not something that we vet them for. So that is something, if you're hiring someone, you probably know a little bit more about how that process would work for them.
Yeah, we really, because this is broad, it's for a lot of different settings, it's really the responsibility of the employer, and again, to do that caregiver background. So that's one thing that's a little bit different than, like, I think on the CNA registry, for example, they probably already been vetted. So this is, and I think we have a disclaimer on the registry that indicates that this does not include the caregiver background.
Any other questions? This overall training, is it available in other languages?
I was not.
And is it available in American Sign Language for individuals who are deaf and hard of hearing?
If not, we should connect.
Yes. It's not yet, but we're in the process. Our Spanish language version will be available by the end of the year. And our I keep saying learning management system. So that's the system that the caregivers go in and take their course in. That's where all their modules are. And it has the ability to change every button, everything to a different language. So whatever language you're in, you don't have to deal with buttons that are in English when you speak Spanish. And then, so all the voiceovers in Spanish, all the subtitles are in Spanish, all of the slides are in Spanish. And then we're going to move into Hmong next year, and then we should definitely talk about ESL. We're not there yet, but Spanish will be out by the end of the year. Great question.
Larry has another verbal question.
Okay. Larry, you can unmute. Go ahead.
Pardon me?
Now I can.
Okay, okay, so if I self-direct and hire somebody on my iris, can they get a $250 bonus?
Yes, they can.
So they be qualified as well. I have a veteran that I think would be a prime candidate to get that bonus, and he's long overdue since he's been way underpaid for, I don't know, 27 years? So, maybe I can tell him about this.
Yeah.
Maybe he'd be willing to take the class.
Yep, and you have our email, so you can direct him to connect with us if he has questions, okay?
Thank you.
You're welcome.
He would also be eligible if he stays with you for another 6 months after that, for that retention bonus as well.
Want me to read it? Okay. Can people with disabilities be a caregiver? How much will the person get paid if they worked in this field of work? So you have a lot of great questions. So let's take them like kind of one by one, Lisa, okay? So can people with disabilities be a caregiver, Kevin?
Yes, they can.
Absolutely. How much will the person get paid if they take this job?
So the payment is really, it's based on the employer. So the state doesn't pay directly to caregivers. They pay managed care organizations pay the provider, and then they have some sort of a rate. We did a survey this last year, and I think the range was that caregivers were receiving somewhere between $10 and $20 an hour, with an average of I think it was around $14.53 an hour. Was the average wage.
Yeah, she's got some great questions actually. Do they receive any hands-on training outside of this?
Yeah, so that's so one of the things that we looked at when we were deciding, do we do this in person or do we do it online? What we really came back on was the online, I think, outweighed all the other advantages that we have because of accessibility, and we didn't want to just make this like you can't just take this training and you're done. This is really a handoff to some of the providers and other agencies for the additional training. So some of that hands-on experience is going to still be needed in addition to being a certified direct care professional. And another scope of work that we have with University of Wisconsin-Green Bay is we are going to look at all of the training that might be out there that might be really good training, and then connect to that through as a micro-credential. So let's say there was a program that had a great program for autism. So you could then be certified direct care professional with a badge as in autism. So then that employer knows, okay, this is my audience, the group that I want to really serve. They would see that in that skills. So we're hoping to have a person that can build their skills up with additional training. And one of those trainings might be that more hands-on care that they might get from an agency or a training program and get a micro-credential for that program as well. So that's a big scope of work that we're just rolling out now. We're putting the application together for an agency that might be interested in becoming one of our micro-credentials. And then, think about we'll have 10,000 caregivers in our system that we could just say, if you want to build your skills, here are some micro-credentials that you might want to look into. And then if we find some gaps, we're going to be contracting with the university to create more modules of training for some of those areas that maybe we don't have anything out there for.
That's my favorite part, is writing on curriculum.
Like, for example, something is on them, but it's not research-based. Is that something you would consider?
I don't know enough about it, but yes. I don't know enough about RPF.
I don't.
Okay, we would have to learn more about it. But I mean, Kevin and I have an endless amount of we have so many ideas. So we're open to hearing anything. I think there really are endless possibilities. Another good question that was asked is, if you can't drive, how would you get to this job? And I want to kind of talk about we're very passionate, I am especially passionate, having spent 10 years at an aging and disability resource center, in providing people the resources they need to meet their needs. And one of the things we want to do is make sure that you have access to all of the transportation pieces in your wherever you live. Is there a bus system? Are there cabs? Are there Ubers? Are there whatever there might be? Is there paratransit? Is there whatever, truly whatever exists? Because we think it's really important that our caregivers have those barriers knocked down as much as possible. It is no secret that that is an underpaid profession, right? We know that they are trying to make ends meet with a very emotionally and physically laborious job. And it can be very difficult when your car breaks down and you don't have money to fix it, or you don't have enough money to pay your rent or for your food or for your health care. And so I feel very passionately about making sure that people know how to access those resources as caregivers, and making sure that I can help them connect to them if they feel there is a barrier. So that is something that we have those on our website, and I'm also always available if people need help finding those in their community, at least at the minimum getting them to the right spot in their community. I'm going to take hers, Patrick, I'll be right back, okay? There you go.
So just a couple questions.
Okay. You're like, sure we're in.
If, for an IRIS participant, if they're an employer putting their information out there, are they adding like the number of hours that they're looking for a caregiver or a shift? How would they enter their information there?
Yeah, I can answer
And then,
that.
sorry, my second question would be, is it temporary? So if they find, if they're just looking for one caregiver or two, do they come off, or do they stay on until, indefinitely if they maybe lose a caregiver?
Sure. They can keep the access as long as they like it. If they'd like to be removed, that's certainly something we would help them do. And then your other question was,
Number of hours.
oh, yeah, so when they post their jobs on Handshake, on with Caregiver Connections, you put everything in, where you live, when you need, what is it, AM, PM, midday shift, how many hours a week, what type of duties do you need help with. All of the Handshake allows you to put everything in there, so in those job postings. That's a great question.
Hey, can you talk a little bit about how we were kind of sensitive to, an IRIS participant that might not want to put their kind of who I am, where I live?
Yes.
But
Yeah, so we have an option to identify yourself as an IRIS participant using your, help me remember. It's not your name. It's like, no, do you remember how we did it? I'm blanking it out of my head. But anyway, so we were very, very cognizant of the fact that people may not want to identify themselves as a Medicaid recipient. That is some protected health information. That's not something you are obligated to share. And so it is I'm going to look on the thing here. There's the option to do the last 4 digits of your phone number, your zip code, plus CDCP. So it's a number that would be unique to them that they would create, but doesn't give us any identifying information to what their name is. I was like, I can't remember what the 2 things are.
And then, with Handshake, it's designed so both sides can communicate to each other, but that person you could just have them, just the IRIS participant finding that individual, and not people competing for them if they choose to do that. So there's different options that we can let them be sensitive.
Of course. The question I have regarding transportation. I will start the issue of county lines. If somebody should cross over county line, I would stop at two with people.
You drive over county lines, is that what you're saying?
Yes.
If your caregiver does?
No. Yeah, taxi or.
Oh, like a taxi or something? Like how do you find out if they do drive over county lines? That's a great question. I don't know.
The one thing there's the caregiver crisis, and then there's the transportation crisis. So let us get this one done. So we just have 1 minute left, and I just want to really thank you all. This was a really engaging session. I appreciate all the questions, and just a show of hands. if you haven't already, are you interested in either signing up as an employer, a caregiver, or telling a friend that this might be a good program?
Excellent.
All right.
And stop by our table, we have t-shirts, birthday kits and chapstick. So please come get some, because I don't want to take them.